Good morning. I want to thank everyone for participating and viewing in to the Pitt County COVID-19 media session number 16. We have an opening statement from Dr. Silvernail, and we do have at least one prepared statement from, I believe, Pitt County Schools as well. So we'll get through those statements and then go into a question and answer period, and we will get started with statements from Dr. Silvernail.
Good morning, Pitt County. We continue to see encouraging trends in our county data. Testing at Walmart is up and running, but we have not received results as of this morning. We will present this data in two ways when we do start to receive it. First, as a part of our county totals, and secondly, as a freestanding testing site. So we know exactly what we're getting from the Walmart testing site. Let's take a look at our data. Here's our Pitt County number of COVID-19 cases by date of specimen collected. And again, you can see the most that we've had on any given day is 7. I ran a quick average on that this morning, and the average was 3.2 across the time that we've been collecting that data. So 3.2 cases per day on average. Next slide shows same data, but as a line graph. And again, you can see that there is no clear pattern to this. There's no geometric expansion or exponential growth of cases in the county. We did have a clump of cases come in yesterday. Some of those were some back cases and back positives that had not been reported to us, but we will track them down eventually, and they were added to our data as of yesterday. This is the cumulative total of COVID-19 cases by data specimen collected. And again, the cumulative total is always going to go up. There was a little bit of a jump up yesterday, but I still feel that we're working our way onto that plateau where our daily case counts will sort of level out over time. This is our percentage of positive tests, percentage as a positive of the total testing results available on that day. And again, we continue to decline here, and we were down to 8.4% as of yesterday afternoon. This morning, we're down a little bit further. We're reporting from afternoon run to afternoon run in this chart. And then finally, the bar graph here demonstrates the total number of tests that we are aware of. The total negative tests at 1665, the positive tests at 153, estimated recovered as of yesterday at 100, and still at 2 confirmed coronavirus related deaths or COVID-19 related deaths. Leave that up. When we look at the state is reporting 13,397 cases across the state. In Pitt County, again, we are at 153. Recovered, we're at 100. In North Carolina, it's estimated there have been 507 deaths from COVID-19. Pitt County remains at 2. Let's move on. We'll finish up talking about some other public health issues, trying to look forward beyond COVID-19. Childhood immunizations. For kindergarten, please be thinking ahead to the start of the next school year. If you have a child that's entering kindergarten, they will need to have certain immunizations to start school. Please make sure your child's immunizations are up to date. We will provide additional information in the coming months about this, and we'll have some opportunities at the health department for children to receive their preschool or pre-kindergarten vaccinations before school starts and after the school year begins. For those of you with middle schoolers, we don't usually think about middle school age children as needing immunizations, but North Carolina requires that the first meningitis vaccine be given to middle school children, particularly those in 7th grade. And finally, for high schoolers, there are some high school seniors who, because they haven't completed a vaccination series, may need catch-up vaccinations or boosters if those series are not complete. So please check for those high school seniors and make sure that those immunization series are complete. Finally, please go home and stay home. And I thank you for your attention. Do you have a statement for somebody else?
Thank you, Dr. Silvernail. We do have one other prepared statement from Pitt County Schools. So Jennifer Johnson, if you are on the call, if you have that statement now.
I do, thank you. So we want to personally thank our school nurses as we celebrated School Nurses Appreciation Day yesterday. Our nurses are still investing in crisis care for our students, along with our school social workers who've been making those home visits, socially distant, of course. And we appreciate all that they're doing. We're also celebrating teachers this week. It's a vastly different year for Teacher Appreciation Week, but we do appreciate our teachers both online and at home. There are lots of great videos of our teachers and that our students have put together for Teacher Appreciation Week that you can find on our social media. We celebrated our school nutrition heroes on Friday, and we'd like to announce that we're getting ready to hit the 500,000 mark for meals that we've served to children age 1 to 18 in Pitt County since school closure, So 500,000 meals prepared by our school nutrition and other school support staff. We think that's a huge accomplishment by our essential school heroes. We do have an announcement regarding the 2020-2021 school year for next year. We've received state rulings that add 5 days to our calendar next year to help us kind of make up for some in-person instruction that was missed this year. The state recognizes that we will need to recalibrate teaching and learning for next year, and those 5 days will help us allow for that. So school will be beginning for students on August 17th, 2020 instead of August 24th. We are meeting soon and should have an updated official calendar for you within a couple of weeks. Finally, if your family's financial situation has changed since school closures, there is a chance to receive some financial relief from the Department of Health and Human Services. They are collecting information from us to distribute these funds to families who may need it. So we ask that if your situation has changed financially, we ask that you please go online and fill out our free or reduced lunch application, as those that are approved are eligible for the financial relief from the Department of Health and Human Services. And we will be distributing some of those documents through meals and our meal distribution sites on Friday. As usual, please see our social media accounts for any announcements we may have, or call our recorded message line at 252-830-3500. Thank you.
Thank you, Jennifer. We'll get into our question and answer sessions right now. We'll start with questions specifically for Dr. Silvernail, and I'll go in the order of call in for the media. We'll start with Elizabeth Johnson with the Daily Reflector. Do you have any questions for Dr. Silvernail?
Yes.
Okay, please go ahead with those while he comes up to the podium.
Okay. Hi, Dr. Silvernail. So my first question is, can you provide an update on the outbreak that occurred at Aiden Court Nursing and Rehab?
Sure. We still have 3 folks there who were diagnosed as COVID positive. One was a resident. That person has been relocated to the company's dedicated COVID-19 facility, and to my knowledge remains asymptomatic. The other 2 individuals, one was part of the clinical staff, one was part of the maintenance staff. Both of those folks remain asymptomatic and are doing well. All of the residents at the facility have been tested and tested negative. The vast majority of the staff tests have also returned negative. As of this morning, there were still a couple that were pending that we were waiting for, but it would look at this point like that is under control.
Okay. Have there been any more cases or anyone showing symptoms at this time?
Not to my knowledge. No.
Okay. Oh, sorry. Continue, sorry.
I was going to say, at that facility?
Yes.
No, as I said, all of the residents have been tested, and all of the residents tested negative at the facility. The staff, the vast majority of them have returned as negative. There are still a couple pending as of this morning, but our hope is that those will return negative as well. And it does appear that that outbreak is under control at this time.
And when was the first case reported at the facility?
Oh, it was over the weekend, I think it came in. Oh, I don't know the exact date of that report.
And where was that, a resident or was that a staff member?
I think they came in about the same time. They were reported to us, I want to say on Monday, towards the end of the weekend into Monday. I don't know which one came in first, the staff or the resident.
Okay. And what measures have the nursing homes in Pitt County been taking to prevent outbreaks and everything? Because, they seem like they're doing a pretty good job preventing coronavirus.
Well, we don't directly regulate the nursing care facilities, the operation of these facilities, but they are limiting their visitors or most of them have prevented visitation for quite some time. They are monitoring their staff, they're monitoring their residents. They have a low index of suspicion to test for the infection. And so far, so good. That what they have done has worked for the vast majority of folks.
Okay. And do you know at this time how the virus may have got into the Hardin Court facility?
We're not clear. There may be a connection between the clinical person and the resident, but the resident had also been outside of the facility. So we don't know if they acquired them from different sources or from each other. We do know the staff person had an exposure at home, and that was partly why the staff person was tested.
So had the staff member been quarantining?
Well, since she has the disease, she is isolated.
Okay. Then now that they did open drive-through testing at Walmart, do you know how many people have already gone through the testing site?
We do not. Walmart has not reported that number to us. The results are going to be reported to the state, and then the state will funnel them back to the local health department.
Okay. So you've seen a decline in cases recently, correct?
We've seen a decline in the rate of positivity of our cases. We average about 3 cases a day.
Okay. At the height of the virus, you said there was like 7, correct? On the most on any day?
The most that we've had reported for any given day is 7 new cases, yes.
Okay. And on average, that was like throughout the entire time the virus has been in Pitt County, it was about 3 cases a day?
Mm-hmm. Oops, I can't go back, can I, Mike? Yes, if I look at that data across from when we identified our first case through today, we averaged 3.2 cases per day.
Okay. And have you seen a fluctuation in the cases?
I think the line graph showed that there's a range of 1 to 7. Most days we're in the 2 to 4 range on cases. And when I average all that data out, it gives me an average of 3.2.
Okay. And how many, so correct me if I'm wrong, but last Thursday we had 120 cases, and today we have 153 cases of coronavirus. So how does that compare to previous weeks?
Again, I think our growth rate on a day-to-day basis has been about the same, where we are seeing in that 2 to 4 range typically per day. So I think that weekly growth rate, which I didn't look at it on a week-to-week basis, but I would guess that is about the same.
Okay. I think that was my last question. Thank you.
You're welcome.
Okay. Next up from WCTI, we have Tyler Hardin. If you have any questions for Dr. Silvernail.
Yes, good morning, Dr. Silvernail. With the phase 1 reopening starting tomorrow at 5 p.m., give me a little bit of insight on kind of what you expect as far as if we could see a potential spike in cases and, how you all are preparing at the health department for this phasing in reopening our economy.
Mm-hmm. We, as people start to move around more, Tyler, we may see some additional activity in Pitt County in terms of the infection. We continue to actively monitor for those cases to track our positive results. It would be, several days before you might see a jump in cases after people start to move around. So we will monitor for that. My staff is prepared to interview those cases and to provide the cases and contacts with appropriate control measures. I think the vast majority of our citizens really do get it. They get the social distancing, they get the hygiene issues with washing their hands, not touching their faces and other mucous membranes, eyes, nose, mouth, things like that. I see many people wearing masks out and about. So I'm hoping that we'll continue to see the gradual accumulation of cases, but not a large spike in cases as we reopen.
Definitely. And for the small business owners and the retailers who are now going to be able to reopen their stores, obviously, there's certain guidelines that they'll need to follow now. Do you have kind of any message to them about kind of helping protect and helping stop the spread of the virus?
Mm-hmm. I've been out to meet with several local businesses and employee groups about COVID-19. I'm very impressed with what our local business community has done to be ready for this. Many markets are shielding their cashiers from direct contact with customers making purchases. The post offices have hung clear plastic in front of the service windows so that their employees aren't exposed. They've increased hand sanitization stations, rearranged cafeterias, things like that in plants to help facilitate social distancing and decrease the risk of transmission. I think most of our businesses have been very responsible and done a great job with this, Tyler, and I think our small businesses will do the same. I think they're anxious to get back to work and are willing to adhere by the guidelines that are out there, and will do a good job of following those guidelines.
Certainly. And just to wrap things up, getting your thoughts on the phasing in, as we go through each phase, is that spot on? Are there any changes that you think we should make, or I mean, what is kind of your message to our local leaders about the phasing in happening all throughout the next couple months?
Well, we are at this time subject to the governor's order. So for now, we will continue to follow the governor's order. If the governor decides to take a more regional approach, then we may adjust some of those things. But I think I'm satisfied with his plan. We will follow his plan as it is laid out and assist our local businesses with the implementation of those guidelines.
Okay, great. Well, thank you, Dr. Silvernail, and thank you for all these media sessions and sharing this important information with the public. We appreciate it.
Well, thank you, Tyler. You're welcome.
Okay, we do have a Pitt County Commissioner on the line, Mary Perkins Williams. Did you have any questions for Dr. Silvernail?
Yes, I do. Thank you, Mike. Dr. Silvernail, I received a question involving concern relating to, how do I phrase this, public residential grouping, such as the Morewood, Hopkins Park, those kind of things. Have there been a special effort to test those residents?
We, as the health department, have not gone out and tested apartment complexes. Again, our strategy has been to spread that testing burden across the medical community here in Pitt County. I'm unaware of any cluster of cases in any of the local apartment complexes at this time. We chose the downtown Walmart for that testing site to try to put that within close proximity to the apartment complexes and other neighborhoods in the central part of Greenville to make that easy access for individuals in that area. It is open to anyone in Pitt County. We do hope that they will increase the testing capacity there, but we have not gone out and specifically tested at apartment complexes, and neither are we aware of any outbreaks at an apartment complex.
Okay, thank you, Dr. Silvernail. I appreciate everything you do and the behind the scenes questions that you have provided for me. I want, as far as those kind of complexes are concerned, they are under the auspices of the Greenville City Housing Authority. Is that correct?
I believe so, yes.
Yeah, they are. They all in the city. Have you communicated with that ED or the person who oversees those facilities and their concerns? Have they been met with any of those?
Not directly. We have a weekly coordination call and we
Mhm.
speak with the manager every week about issues in the county and in the different municipalities. And the city manager has not brought up any concerns about the housing complexes in Greenville to me.
All right. Thank you so very much. I expressed to the resident that I will ask that question, and I did. I appreciate everything you do, and I hope you will hang in there and stay safe.
Well, thank you, Commissioner. You do the same.
Thank you, Dr. Silvernail.
Is that it? All right. Thank you, folks.
We will open the floor for any questions of our other agencies or municipal partners that are on the line right now. Just want to recap who we have in the building and also online virtually. We do have the county manager, the county emergency management director. We also have Pitt County Schools, Pitt Community College, and Greenville Utilities as well. Tyler Hardin with WITN had to drop off the call, so it is just Elizabeth Johnson with the Daily Reflector now. Elizabeth, do you have any questions for any of the other agencies present?
No, thank you.
All right. Commissioner Mary Perkins Williams, did you have any other questions?
Oh, no, thank you very much. I'm satisfied.
Okay. Just want to give a quick note that programming note here. This will be the last week that we run 2 sessions per week. As we transition into phase 1 of the governor's plan, we will drop down to 1 session per week. The next session will be held on Thursday, May the 14th, and it will again be at 11:30. In the meantime, I encourage everyone who wants information on Pitt County's response to visit our website, pittcountync.gov/coronavirus, or call the hotline at the Pitt County Health Department at 902-2300, or you can request information via the online request form at pittcountync.gov/COVID-info. Once again, reminding that next week we will be down to 1 media session per week. And again, that will be Thursday, May the 14th at 11:30. Thank you all for watching.